Everyone. Thank you for attending today's overview on MN371, a new diagnostic screening tool for Morbinovus disease. As you are likely aware, Morbinovus is translated from Latin as new disease. Morbinovus is a retrovirus and thus has the ability to mutate rapidly. Although antiretrovirals have been shown to be minimally effective in early trials, there is no cure for this disease. Containment of the disease has been extraordinarily difficult as the incubation period far exceeds the latent period, meaning individuals shed virus to others long before they have symptoms. When symptoms do appear, they are most unusual. They present with syngultus and are known to be profoundly anthropophobic, exhibiting an intense fear of being around other people. The resulting consequences to society are astronomical, as more and more citizens actively avoid everyone around them. Unfortunately, this propensity to avoid others has done little to contain the disease, as by the time individuals become symptomatic, the diseases R naught of 5 means they have likely already infected several others. To effectively stop the outbreak, early screening measures prior to symptom onset are desperately needed. Up until now, the only way that researchers have been able to identify patients with Morbinovus has been a CT scan with contrast. This is an expensive and time-consuming procedure, and thousands of cases have been reported of individuals having severe allergic reactions to the contrast dye. Furthermore, patients who are already symptomatic are often non-compliant with their appointment visits, and CT technology is too bulky to be brought into individual homes. That's where MN371, a new screening test for Morbinovus, comes in. The procedure is simple, a basic blood draw that can be performed inpatient, outpatient, or even out in the field at patient homes. Unlike a CT contrast that requires a radiologist to determine results, MN371 is a lab test and results within 3 days. The test is a fraction of the cost of a CT contrast. For patients who are symptomatic and already afraid of being around other people, compliance is more likely when a home blood draw can be performed. MN371 is a helpful tool, but it isn't going to replace the CT contrast entirely. Let me demonstrate why by using the results from our most recent study in a sample size of 10,000 people. The test is highly sensitive, picking up on disease presence when disease is truly present 91% of the time. Conversely, MN371 is not highly specific. It is not all that helpful in ruling out a true negative, as evidenced by the high number of false positives. It only correctly rules out disease presence 15.78% of the time. Sensitivity and specificity of a test are highly important in understanding the implications of a test result for an individual, but even more helpful for understanding the true diagnostic performance of a test are the positive and negative predictive values. The positive predictive value is the proportion of positive tests that really are true positives. The positive predictive value of MN371 is 14.96. In other words, roughly 15% of all positives, as determined by MN371, are truly positive. This means that a positive test result is not particularly helpful. However, MN371 performs much better when utilized for its negative predictive value. For MN371, the proportion of negative tests that are truly negative is 91.5%, or over 9 of 10. This is a strong negative predictive value, which makes MN371 effective for identifying negative cases and ruling out diseases for those who test negative. Like almost every other screening test for any illness, MN371 is not perfect. It will not give you a clear yes or no answer on disease process. MN371 should be viewed as an inexpensive screening tool for Morbinovus. When cases result as negative, they are most likely negative and may not necessitate a CT unless other clinical indications are present. When cases are positive, a CT contrast will still be needed to clarify presence or absence of disease. View MN371 as a starting point and a preliminary starting tool to minimize the number of cases going through a contrast CT. The CT contrast should be used as the true diagnostic tool to rule disease in or out, but due to its expensive nature, attempts to screen patients with MN371 should be used first. I will now take any questions you may have on the use of MN371. Thank you.